Let's review our advanced setup plan together. First of all, what's the purpose? The purpose of advanced setup plan is to help dental practices not only organize their virtual space, but go really deep in organizing their physical space, from cleaning up to getting rid of the clutter to putting the right storages and helping design the flow that's going to fit your dental practice. So let's break down the steps. Number one, every single advanced setup starts with a FaceTime call. So most likely we'll coordinate the time within 2 to 4 or 5 days from the setup to literally look at every single corner of the practice. Prior to that, I'm going to get the floor plan so that we can take a look together at all the changes that we need to make. If you have double storages, can we organize everything into a single storage? Do you have a washer and dryer that needs to get moved into another space? Do you have something else going on? We will also review your storages in sterilization, in the lab, in the treatment room. I'm going to ask you guys to open up the drawers or take a look at what's behind the cabinets in the sterilization. We'll also see what needs to be removed. Maybe some of the cabinets we need to get removed for that easier flow of the practices or the products, and also to make sure that we create an environment where your team members are not stacking items in two places at the same time. So during the FaceTime call, we're going to review the floor plan, and the idea behind the call is know exactly what we're going to do, the steps that we're going to take with storages, the physical space, how we're going to move things around, and also design the order for the storage units, what we call the Tipout Bin. So at the end of the call, you're going to have a full Tipout Bin design. After that, you're going to go into the organizing the actual space within Zen supplies. So we will discuss either Zen will be organized by the categories or by procedures like endo, restorative, and things like that, or you're going to organize Zen by the physical space. So for example, everything in a shelf somewhere by sterilization cabinet, that's going to be your shelf 1, which is going to be S1, and then all the products listed there. More examples are going to be shown during the training. Now the next step number 3 would be the FaceTime again when your Tipout Bins arrive, and that's we're going to organize the physical space again, assemble the Tipout Bins. We're going to look at it before they even get mounted into the wall. We'll make sure that it's properly mounted, the proper design, and we're going to look at the templates for each individual treatment room. So what goes in the room, what are the quantities, and things like that. And then finish up with the training, which is going to be our step number 4. Finish up with the training where we're going to discuss the Zen Out, the app, make sure that we design the virtual space and the physical space together and it actually matches. And then we're going to go into the fun part. Every month we're going to have, for 3 months, we're going to have a follow-up call where I answer the question of one of our team members. We go over again if the physical and virtual space works together, and the idea is within 3 follow-up calls it actually should match, bring the value, drop the overhead down to about 5 to 4%, and really make your team spend a lot less time on managing inventory and running around and just literally never run out of products. So hopefully that helps, and we can't wait for you guys to get organized and feel that new refreshed feeling when everything is in the right place and everything flows, and we call it a total Zen within a practice.